Good morning, all. Today's topic is cholinergic system and drugs. Now, cholinergic transmission acetylcholine is a major neurohumoral transmitters at autonomic, somatic, as well as central site. Now, synthesis, storage, and distribution of acetylcholine. The cholinergic neural mechanism are summarized. Uh, the acetylcholine is summarized locally in the cholinergic nerve endings by the following pathway: ATP plus acetate plus co-NLH. Now, acetate activating reaction to acetyl CoA enzyme. Now, choline to choline acetyl transfers acetylcholine plus coenzyme C. Here, and we can see the attachment of the CH3 and CH3, one side CH2 O, C double bond O, and CH3 Cl, acetyl chloride. Acetyl is uh, actively taken up by the axonal membrane by a sodium ion choline. Contrasports co-transporter and acetate with the help of ATP and coenzymes by the enzyme choline acetyl transfers present in the exoplasm. Hemicolinium HC3 blocks choline uptake and depletes ACH. Most of the ACH is stored in ionic solution within small synaptic vesicles, but some free ACH is also present in the cytoplasm of cholinergic terminals. Active transport of ACH into synaptic vesicles is affected by another carrier, which is blocked by vasochemical. Research of HCl from nerve terminals occurs in small quanta amount contained in individual vesicles, is extruded by exocytosis in response to a nerve ATP and synchronous release of multiple contained triggers post-junctional event. Two toxins interfere with cholinergic transmissions by affecting releasing botulinum toxin inhibits release, while block wide spider toxin induce massive release and depletions. It is a botulinum toxin. Botulinum toxins A and B are highly potent extortion procedures by Clostridium blurium that are responsible for botulism. These neurotoxic proteins causes long-lasting loss of cholinergic transmission by interacting with axonal protein involved in exocytotic release of acetylcholine. Now, cholinesterase immediately after release ACH is hydrolyzed by the enzyme cholinesterase and cholines is recycled. A specific acetylcholine traces acetylcholine E or true cholinesterase as a non-specific type of enzyme occurs in the body. Important uh, differences between these two types of enzymes are given in the table. Acetylcholine E is strategically located at all cholinergic sites of serves to inactivate acetylcholine in transversely. Now BUCHE present in the plasma and elsewhere, uh, probably serves to metabolize ingested ester. Acetylcholine divided into choline plus acetate, cholinesterase. Now we can see in the table site of the cholinergic transmission and type of the receptor involves. Here is the site, type of receptor, selective agonist and selective antagonist. First in A, all prostaglandins parasympathetic. B, few prostaglandinic sympathetic sweat glands and some blood vessels. U, muscarinic and atropine. Now 2, in A and B, ganglia, both sympathetic and parasympathetic, and adrenal medulla. Here is nicotinic and selective DMPP and hexamethonium. 3 is skeletal muscle, nicotinic and A and PTMA and D tuberculin. 4 CNS cortex, basal ganglia, spinal cord and other site, muscarinic and nicotinic, muscarine and exotremorenin and carbacols, and here atropine and D-tubulorin. There is a DMPP is dimethylphenyl piperazinium and PTMA is phenyl trimethylene ammonium. Here this is a figure. Now the cholinereceptors. Two classes of receptors for the ACH are recognized, muscarine and nicotinic. The former is G protein coupled receptors, while the latter is a ligand get quotient channel. Now muscarine. These receptors are selectively stimulated by muscarine and blocked by atropine. They are located primarily on autonomic effector cells in the heart, blood/eye, smooth muscle and glands of gastrointestinal, respiratory and urinary tract, sweat glands, etc. Now subtypes of muscarinic receptor. By pharmacological as well as molecular cloning technique, muscarinic receptors have been divided into 5 subtypes: M1, M2, M3, M4 and M5. The first 3 are the major subtypes we can see in the table that are present on effector cell as well as on pre-junctional nerve ending and express both the peripheral organ and as well as the CNS. The M4 and M5 receptors are present mainly on the nerve ending in certain areas of the brain and regulated the release of other non-transmitter functionally. M1 and M3 and M5 fall in the one classes, while M2 and M4 fall in the another classes. Now we can see the table number 7.2. Differences between the two types of cholinesterase. There is a acetylcholinesterase and butyrocholinesterase. One is twin, second is pseudo. First is distribution. All cholinergic site RBC, and the pseudo is plasma, liver, intestine, white matter. Second, hydrolysis, acetylcholine, methylcholine and benzocholine and butyrylcholine. Very fast, slower than the acetylcholine, not hydrase and non-hydrase, and the slow, no hydrase and hydrase and hydrolyze. Now 3 inhibits, more sensitive to gamine and more sensitive to the organophosphatase. Now functions: termination of the ACH action and hydrolase of the acetate ester, ingested ester. Now there is a M1. The M1 is primarily neuronal receptors located on the ganglion cells and the central neuron, especially in the cortex and hippocampus and corpus stimulus. Now M2 is cardiac muscarinic receptors are predominantly M2 and mediated vagal bradycardia. Now there is the table 7.3. There is a location and function of severe and autonomic ganglia. Gastric gland is M1, and depolarization heats release acid secretions, and M2 SA node and atrium AV node and node, it is effect on the cardiac system. M3 vascular smooth muscles contractions and iris ciliary muscles and exocrine glands, and the effect on these all structures. Now nature: GQ protein coupled and GIGO protein coupled and GQ protein coupled. There is a different way of the M1, M2 and M3. Now transpiration mechanism: IP3DAG increase cytosolic calcium channels and PG synthesize calcium potassium channels opening in CAMP, and here M3 is IP3DGS cytosolic calcium channels and PLA2 increase PG synthesis. Agonistic meconium axonomatrix and mechanocolins and methylcolins. Now antagonists primarily talins and methylcolins, soliphenylacin and deriphenacins. Now the table number 7.4, characteristic of subtypes of the nicotinic receptors, NM and NN. There is a location, function, and subset. Neuromuscular junction, we have in NN autonomic ganglia. There is a nature has intrinsic ion channel parameters, and NN has intrinsic ion channel and parameter of only alpha and beta subtypes. Now transverse mechanism: opening on cation sodium and calcium channels, opening sodium, calcium and potassium channels. Now against PTMA nicotine and DMPP nicotine. Now antagonist: tuberculin alpha benzguator toxic and hexamethonium and trimethonium. Here is the M3, the visceral smooth muscle contraction and granulation selection are elicited through the M3 receptors. Now nicotinic: these receptors are selectively activated by the nicotine and blocked by the tuberculin or hexamethonium. They are rosette-like pattern structures. Here NM, these are receptors of skeletal muscles and plate and selectively stimulated by the phenyl trimethyl ammonium and blocked by the tuberculin. Now NM, these are present on ganglionic cells and adrenal medullary cells. Now cholinergic drug: cholinomatics parasympathetic. These are drugs which produce action similar to the of acetyl either by directly interacting with cholinergic receptors. Here the cholinergic agonists: cholinergic ester, acetylcholine, methylcholine, carbohol and methanol. Here is alkaloids: muscarine and pilocarpine, and choline. The action. Depending on the types of the receptors through which is mediated, the peripheral action of the acetylcholine are classified as muscarinic or nicotinic. Now, muscarinic action. First, in the heart, acetylcholine hyperpolarize the SN node cells and decrease their rate of the diastolic depolarization. On here the blood vessel. All blood vessels are dilated through only few receiving cholinergic innervation. Fall in the BP of flushing, especially in the blues area, occurs. Mesoclorine receptors are present on vascular endothelial cells. Here, the smooth muscles. Smooth muscles in the most organ is contracted. The tone and the perisystolis is the gastrointestinal tract in the increase and sphincters relax, abdominal cramps and elevation of the bowel. Now, glands. Secretion from all parasympathetically innervation glands is released via M3 and some M2 receptors, sweating, salivation, lacrimation, increase tracheobronchial and gastric secretion. Like now, 5 eye contraction of circular muscle of iris, miosis, contraction of the ciliary muscles, spasm of accommodation, increase outflow of facilities. Now, nicotinic action. Autonomic ganglia, both sympathetic and parasympathetic ganglia are stimulated. This effect is manifested at higher dose. Higher dose of acetylcholine given after atropine causes tachycardia and rise in BP due to stimulation of the sympathetic ganglia and release of the cholinergic. Now, skeletal muscles. Iontophoretic applications of the acetylcholine is muscle and plate causing contraction of the fiber. Now, CNS action. Acetylcholine injected IV does not penetrate blood-brain barrier and no central effects are seen. The table 7.5 properties of cholinergic. There is a cholinergic ester, methylcholine. There is a give effect on the different system. Now, drugs, we can see the interactions. The cholinergic esterase proteinate acetylcholine marked methylcholine to less extent and have only additive action with carbachol or bethanyl. Now, uses. Cholinergic esters are rarely, if ever, clinically used. Acetylcholine is not used because of events and non-selective action. Now, bethanyl has been used in post-operative, postpartum, non-obstructive urinary retention. Now, cholinergic alkaloids. Pilocarpine, it is obtained from the level of Poliocarpus molecules and the other species. It is prominent muscarinic action and also stimulates ganglia. The pilocarpine causes marked sweating, salivation, increase the other secretions. Here, the vascular effect of the complex and small does generally causes fall and blood pressure. Now, here we can see the different drugs, muscarine and mushroom poisoning. The muscarine occurs in the poisonous mushroom amata, masculine and anaconda species, and has only masculine action. Now, mushroom poisoning depending on the toxic principles present in the particular species. At least three types of mushroom poisoning in known. Muscular type due to inocybo and related species symptoms characteristic of the muscarine action occur within the 1 hour and eating the mushroom and the prompt review of the atropine. Now, hallucinogenic type. It is due to the musclamine and the other isozazole compounds which is the present in the A muscarine and related mushroom is much larger quantities than the muscarine. Another heliolide type, it is due to the peptide toxin found in the A phalloids and galerine and the related species. Now, accelerine, it is found in betel nut and Erica etula and has muscarine as well as nicotinic action. Now, anticholinergic are agents which inhibit CHE cholinesterase or protect acetylcholine from the hydrolysis produce cholinergic effect in vivo and protein acetylcholine both in the vivo and the vitro. Some anti-CHE cholinergic esterase have additional reduction action and nicotinic cholinergic receptor. Now, reversible carbamide and ericdane, physiostigamine and terine, neostigamine, periodostigamine, androphenium and reverstigamine and donepezil, galantamine, reversible organophosphates, diphos and carboxamide. There is a diflos, DEP and carbaryls 7. Ecothiopate and propruxor, bicon, diazinon, tubuin, serine and salmon. Now, chemistry, anti-cholinergic esterase, either ester of the carbonic acid or derivatives of phosphate acid and generic formula of the chemicals and the phosphate. You can see the formula of the carbamates and orgophosphate. Now, the mechanism of action, the anticholinergic reaction, which is the enzyme estimated in the way of the acetylcholine, the chambers and phosphate respectively, carbamate, mylate and phosphorylate and strict and enzyme, where the acetylcholine enzyme reacts the water extremely rapidly and the strict site in the freedom in the function of the millisecond and carbamylate enzyme react slowly and the phosphorylate enzyme react extremely slow on not or and all. You can see the different drug action in ANS.